Everything you must know before using Ozempic for weight loss. There comes a point when the mirror feels unfamiliar, when the weight just won't move no matter how carefully meals are chosen or how often walks are taken. For many over 50, this isn't about appearance, it's about energy, joints, and staying independent. Lately, a medication called Ozempic has been gaining attention for weight loss. It sounds like a simple solution. But is it really that simple? Before making any decision, there are things that must be understood, not just the benefits, but the hidden risks, the long-term effects, and whether it's truly right for this stage of life. If staying healthy, strong, and independent matters, take a moment to subscribe to this channel. These videos are created to guide and protect health after 50. Like this video and share your thoughts below. Your experience might help someone else make a safer, wiser decision. Ozempic works by mimicking a natural hormone called GLP-1 that helps control blood sugar levels and appetite in the body. This hormone is normally released after eating, signaling the brain that enough food has been consumed. By copying this signal, Ozempic helps reduce hunger and makes portions feel more satisfying than usual. Another important effect is how it slows down digestion. Food stays in the stomach longer, which means sugar enters the bloodstream more gradually. This helps prevent sharp spikes in blood sugar, something many doctors consider especially helpful for people with insulin resistance or type 2 diabetes. However, this slower digestion can also lead to feelings of fullness that last longer than expected. For adults over 50, these changes can affect the body's overall relationship with food. Reduced appetite may lead to eating less than needed, which can lower intake of essential nutrients like protein, vitamins, and minerals. Some doctors warn that this can impact muscle strength and energy levels if not carefully managed, because Ozempic changes both hunger signals and digestion speed. The body begins to process food differently over time. Weight loss often follows, but it is not only about eating less. It reflects a shift in how the body handles food, stores energy, and responds to fullness cues, which becomes especially important to understand with aging metabolism. These effects may seem helpful for weight loss, but they also require awareness in older adults. When digestion slows and appetite drops, the body may not signal hunger in the same way as before. Some healthcare professionals advise monitoring eating patterns closely to avoid unintended weakness or fatigue, especially during long-term use. This makes Ozempic was originally developed to help manage type 2 diabetes by improving blood sugar control in people whose bodies do not use insulin effectively. It works by supporting the body's natural ability to release insulin when needed and by reducing excess glucose production in the liver. Medical approval for Ozempic was based on its effectiveness in lowering blood sugar levels, not as a primary treatment for weight loss. In recent years, attention has shifted toward its ability to reduce appetite and promote weight loss, leading some individuals to consider using it without having diabetes. However, many doctors emphasize that using a medication outside its intended purpose should always be approached with caution. When a person does not have blood sugar problems, altering these systems artificially may create unnecessary imbalances. For adults over 50, this concern becomes more important. The body's systems are often more sensitive, and introducing a medication designed for a specific medical condition may lead to effects that are harder to predict. Some healthcare professionals warn that lowering blood sugar in someone who already has stable levels can increase the risk of dizziness, weakness, or even hypoglycemia in certain situations. There is also the question of medical necessity. Treatments like Ozempic are usually prescribed when the benefits clearly outweigh the risks. Without a diagnosed condition, such as type 2 diabetes, those benefits may not be as strong, while the risks remain present. This balance is especially critical for seniors, who may already be managing other health concerns. Understanding why Ozempic was created helps place its use into proper context. It is not simply a weight loss tool, but a medication designed for a specific metabolic condition. Using it without that need may expose the body to changes it was never meant to handle. After the age of 50, the body experiences natural changes that make weight loss more complicated than earlier in life. Metabolism slows down, meaning that fewer calories are burned at rest, and even regular daily activities may not require as much energy as before. Muscle mass begins to decline, a process known as sarcopenia, which further reduces the body's ability to burn calories efficiently. Hormonal shifts, including decreases in estrogen or testosterone, also alter how fat is stored and how appetite is regulated. These changes make the body more prone to holding onto fat, especially around the abdomen, and make rapid weight loss more challenging. Medications designed to reduce appetite or slow digestion, like Ozempic, affect more than just fat stores. Some doctors warn that using such medications without proper supervision can unintentionally reduce muscle mass because older bodies may already struggle to preserve lean tissue during weight loss. This loss of muscle can impact strength, balance, and overall mobility, which are vital for maintaining independence after 50. Even small reductions in muscle can increase the risk of falls, fatigue, and slower recovery from illness or injury. Research indicates that the combination of slower metabolism and natural muscle decline means that weight loss approaches effective in younger adults may not produce the same results in older adults. Medications that influence appetite or digestion can accelerate weight loss, but they may also disproportionately affect muscle rather than fat if not paired with adequate protein intake or resistance exercises. Doctors emphasize understanding these unique physiological changes before starting any weight loss medication, because preserving muscle and strength is just as important as reducing fat for long-term health and vitality. Ozempic can cause several common side effects that should never be ignored, especially in adults over 50. Nausea and vomiting are among the most frequently reported, sometimes appearing in the first few weeks of use as the body adjusts. Even mild nausea can reduce appetite and food intake, which may lead to inadequate nutrition or unintentional weight loss. Digestive discomfort, including bloating, diarrhea, or constipation, can also occur and may persist intermittently. Fatigue is another possible effect, as the body responds to changes in blood sugar regulation and slower digestion. For older adults, these side effects carry additional risks. Mild dehydration from vomiting or diarrhea can happen quickly and may not be immediately noticeable. Some doctors warn that even a slight decrease in fluid intake can lead to dizziness, weakness, or low blood pressure. Fatigue combined with reduced muscle strength increases the risk of falls or accidents, which can have serious consequences in later life. Digestive discomfort can also impact the absorption of essential nutrients. Seniors are already more susceptible to deficiencies in protein, calcium, and other vitamins, so persistent digestive issues may compound existing health concerns. Healthcare professionals emphasize monitoring symptoms carefully and adjusting medication or diet as needed to prevent complications, because these side effects can escalate rapidly in older adults. Awareness and early intervention are critical. Regular communication with a healthcare provider is essential to ensure that side effects are managed before they interfere with overall health. Even minor symptoms should be taken seriously, as timely adjustments can prevent dehydration, weakness, and falls while allowing the medication to be used more safely. Rapid weight loss from medications like Ozempic can reduce not only fat, but also muscle mass, a risk that becomes more pronounced after the age of 50, as the body naturally loses muscle with age. Any additional reduction can have serious consequences. Some doctors warn that when appetite decreases and caloric intake drops quickly, the body may break down muscle tissue to meet energy needs, rather than exclusively burning fat. This can result in a decrease in strength, slower metabolism, and reduced physical resilience. Muscle loss in older adults is particularly concerning because it affects balance and mobility. Weakness in the legs or core muscles can make simple daily activities, such as standing from a chair or climbing stairs, more difficult. Medical research shows that even modest declines in muscle mass are associated with a higher risk of falls, which are a leading cause of injury in people over 50. Loss of muscle can also prolong recovery from illness or surgery, since the body relies on protein stores and muscular strength for healing. In addition, reduced muscle mass further slows metabolism, making long-term weight management more challenging. Some healthcare professionals emphasize that weight loss should be gradual and carefully monitored, with attention to maintaining lean tissue. Without this oversight, the benefits of fat reduction may be overshadowed by the negative effects of muscle loss, including fatigue, instability, and diminished independence. Because of these risks, monitoring muscle health during any weight loss program is essential. Regular assessments of strength and body composition, along with professional guidance, help ensure that weight reduction targets fat rather than muscle. Avoiding unmonitored use of appetite-suppressing medications can protect overall function, strength, And long-term well-being after 50. Ozempic is not recommended for certain groups of people because it can pose serious health risks when underlying conditions are present. Individuals with a history of thyroid disorders, particularly medullary thyroid carcinoma or multiple endocrine neoplasia type 2, are considered high risk. Doctors caution that GLP-1 receptor agonists, like Ozempic, may stimulate changes in thyroid tissue, which could increase the likelihood of complications in these patients. People with severe digestive conditions, including gastroparesis or chronic inflammatory bowel disease, may also experience worsening symptoms, as Ozempic slows stomach emptying and can intensify nausea, bloating, or other gastrointestinal discomforts. A history of pancreatitis is another important consideration. Some studies indicate that GLP-1 receptor agonists may increase the risk of pancreatic inflammation, making Ozempic unsafe for those who have previously experienced pancreatitis. Healthcare professionals emphasize that even mild prior episodes should be taken seriously, as recurrent inflammation can lead to long-term damage and digestive complications. Older adults with fragile health are particularly vulnerable. Age-related changes in kidney function, liver metabolism, and overall resilience mean that adverse effects can escalate more quickly than in younger adults. Fatigue, dehydration, or electrolyte imbalances from side effects may have a greater impact, and recovery may take longer. Some doctors recommend a thorough medical evaluation before starting Ozempic in seniors, especially if multiple health conditions or medications are involved. Understanding who should avoid Ozempic is crucial for safe use. Patients with thyroid disorders, severe digestive issues, or a history of pancreatitis face higher risks, and older adults with fragile health must exercise extra caution. Medical supervision is essential to ensure that potential complications are minimized, and the benefits of weight management do not come at the expense of overall health and safety. Safer alternatives for weight loss after 50. Focus on natural approaches that support overall health while reducing fat gradually. A balanced diet, rich in vegetables, fruits, whole grains, and lean protein, helps provide essential nutrients that the body needs to maintain muscle, bone strength, and energy levels. Research shows that adequate protein intake is especially important for older adults, as it preserves lean muscle mass during weight loss and supports metabolism, which naturally slows with age. In addition to diet, regular physical activity is crucial. Walking is one of the safest and most accessible forms of exercise, promoting cardiovascular health, improving circulation, and aiding digestion. Even moderate daily walks can contribute significantly to calorie expenditure and enhance overall well-being. Strength or resistance exercises are also recommended, as they directly combat age-related muscle loss. Studies demonstrate that incorporating light weights or resistance bands 2 to 3 times per week can improve balance, stability, and functional strength, reducing the risk of falls and injuries. These approaches may produce slower results compared to medications, but their benefits are sustainable and come with minimal risk. Unlike rapid pharmacological interventions, gradual weight loss through diet and exercise allows the body to adapt without compromising nutrient intake or muscle mass. Healthcare professionals often emphasize that consistency is more important than speed, and that's small, sustainable changes over time can lead to lasting improvements in weight, energy, and independence. Natural strategies also promote better long-term health markers, including blood sugar regulation, blood pressure control, and improved joint function. By focusing on these safer alternatives, older adults can achieve weight loss goals while preserving strength, vitality, and overall quality of life, making gradual, healthy changes the most reliable choice after 50. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.